Well, thanks so much for joining me today for the kickoff of Season 3 of the Healthy Skeptic MD podcast. I'm Dr. Michael Hochman. We have a great kickoff episode today with an update on where we are with the COVID-19 pandemic and an emphasis on children. In general, this season of the Healthy Skeptic MD, we're going to continue our discussions about key common health topics that many of us need to be concerned about. And we're going to particularly emphasize emerging or new technologies. For example, we have a really good upcoming episode on gene therapy in 2 weeks. One quick housekeeping item before we get into today's episode. I'm going to start releasing these episodes every other week. So going forward, please do look for us every other Friday, wherever you listen to podcasts or on my YouTube channel. So I do have a very special guest for today's episode, my wife, Pediatrician Dr. Jessica Hochman, who's going to help us understand where we are in this pandemic with respect to children. There's been a lot of news about children, a greater spread of one of the new variants, B.1.1.7. That's the variant first identified in UK. There's also been a lot of discussions about school reopening. So Jessica will be a great person to help us break it all down. If you do find today's episode engaging, please search and subscribe wherever you listen to podcasts or on YouTube. Search Healthy Skeptic MD. Let friends and family know. And if you do have a chance, please do consider leaving a review. So before we jump into today's interview, let's do a quick rundown of the health news of the week. So first, some good news regarding the COVID-19 vaccine. So as we already know in the trials, it's been shown that the Moderna and Pfizer vaccines prevent severe COVID infections by 90% or more. But what was not known is whether the vaccines also prevent mild illness, which is important to understand because that's what may lead to transmission of the virus. So in a CDC report released last week, it reported that the vaccine is about 90% effective in preventing mild disease. And in fact, even a single dose is 80% effective. So this is really good news because if we can block transmission, it'll really allow us to help get out of this pandemic. So that's really good news. But this is balanced by, of course, the bad news that many of you are aware of about the Johnson & Johnson vaccine and the link with blood clots in the brain. This is similar to the link or the concern that's raised about the AstraZeneca vaccine and these same types of blood clots. Now, interestingly, both the J&J and the AstraZeneca vaccine use a similar technology, the adenovirus. So that obviously raises some concern that may be the problem here. This concern is rare in the J&J situation here in the United States. There were 7 blood clots in the brain in 7 million doses of the vaccine that have been given so far, so pretty rare. But of course, I think this is a very important concern. We need to take it very seriously, and I do think pausing vaccination, it was the right thing to do until we learn more. But I will end this news summary on an up note. So preliminary studies had suggested that this B.1.1.7 UK strain may be more aggressive and cause more severe illness than the standard strains. There was a new analysis just published this week in The Lancet that found no evidence of this. So this analysis did confirm that this B.1.1.7 strain may transmit more quickly and more readily than the standard strains, but no evidence of increased disease severity, which is certainly very good news. So with that, let's jump into our interview with Dr. Jessica Hochman. Well, welcome back to the Healthy Skeptic MD, Dr. Jessica Hochman.
Thanks for inviting me back.
And first, I have to say, since we last spoke, there's been a new media initiative that Jessica started called Ask Dr. Jessica with medical questions for parents. Tell us a little bit about Ask Dr. Jessica.
I started a YouTube channel called Ask Dr. Jessica where I try to put hot topics or questions that parents ask me frequently, and I summarize them succinctly under 5 minutes on a YouTube page.
So, of course, in my unbiased opinion, it is excellent, but do check it out. Ask Dr. Jessica on YouTube.
That's right.
Okay, so we are going to, again, talk about COVID with an emphasis on children today. So let's just start at the highest level. Cases have dropped about 4-fold since the peaks in December and January. Death rates are down a lot of good things. How are you feeling overall about the pandemic?
I actually feel cautiously optimistic. I have a good feeling that as the vaccinations continue to roll out in the United States and as we see numbers decline, I think we're in good shape. I'm optimistic that the worst is behind us.
I do feel optimistic. I mean, no one's got a crystal ball and knows exactly where things are going. But, with the vaccine getting out there, I think a lot of us are feeling really good. But I think one of the big wild cards out there, of course, is the variance, and that's where I wanted to start. So variants, mutations happen with pretty much any infectious disease, any virus or any other bacterial infection. There's terms like double mutants out there, which can be scary. But should we be nervous off the bat when we hear the term variance, or what does it mean?
So I think you bring up this is going to be a great discussion topic, because when we listen to the news, as we all do, they bring up the variants, and it's hard to know how nervous to feel about them and how cautious to think about variants. Should it change our behavior in any way as we all get vaccinated? And why I think this is interesting to point out is that this is totally expected. I want to point out that all viruses mutate. A good example of this is the yearly flu shot. The reason why we recommend giving it every year is because there are expected mutations with every flu season. So saying that there are variants to COVID-19 or SARS-CoV-2 is something that's not unexpected. And I think what's been interesting is so far we've traced, I think, under 8,000 mutations. And most of these, by and large, are innocent mutations that cause no change in how we see COVID-19.
Yeah, so what I think I'm hearing you say here is that there's thousands and thousands of mutations. There's a few we focus on because they're gaining traction. But mutations are what happens. There's double, triple, quadruple mutants of the flu. And this is just part of biology. This is exactly what we would have anticipated.
That's right. And I think the big question is with these variants that we're in particular, why we're looking in particular at the B117 and the B1351 from South Africa and the P1 lineage from Brazil. Those are getting a lot of attention because they're showing mutations or protein effects in the spike protein, which is where our vaccines have been targeting. So we want to make sure that the place of target for the vaccinations isn't affecting how the vaccine's working. But so far, the good news that I want to impress upon everybody is that while I think it is of utmost importance that the scientists are continuing to survey these mutations, is that right now all the data is pointing towards the fact that the vaccines that are available are effective against these variations.
But I want to spend some time on the B117 variant. This is the variant from Britain, and I think the last check I saw, about a third of cases in the United States, the predominant strain is now this B117. And what's I think caught some headlines is that the original strains of the coronavirus have not infected kids to the same extent as adults, but this B117 strain does seem to be infecting kids. So what do we know so far about that?
So it's definitely something that we should all be keeping a close eye on. What's interesting about children, and what's been great news so far with the original strain, is that kids were looking to be basically dead enders of the virus, so are really contributing to very little of the spread of COVID-19. Some of that was thought to be because kids make fewer of those ACE2 receptors I had mentioned just previously, and so it was harder for kids to get infected and thus spread it. So some reports showed kids under 10 only contributed to about 5% of total COVID-19 spread, which is unlike most other viruses that we see every year. But what's interesting about this B117 is it's looking like early data showing that kids may be more transmissible amongst children. So that would be something different, that no longer are kids the dead enders of COVID-19, but they are potentially attributing some of the spread. But something that's really important to point out is that my feeling is if we can get everybody vaccinated that's vulnerable, so specifically the elderly, those with comorbid conditions, and hopefully all adults, even if there's more transmissibility with this B117 variant, hopefully we'll still be able to see the pandemic continue to dwindle down.
And just a little more about the B117.
Yes.
In particular, Michigan, there have been some outbreaks in schools. So Michigan has, over the last couple months, opened up some of their schools, and there have been clusters there. And I think Michigan's now one of the big hot spots in the United States.
I think that's definitely a cause for concern. I mean, I think that looking at Michigan, seeing how their cases and hospitalizations have increased, we do have to keep a watchful eye on the variants and how it's contributing. And it almost makes it a race for getting vaccinated. I look at it like we want to outpace the virus and hopefully get enough Americans and those in the world vaccinated so that we can win the race with these variants. The great news at this point that I want to impress is that while there's so much discussion about the variants, the overarching point is that the vaccines still work against these variants right now, which is great news.
And this B.1.1.7 variant, the vaccine does seem to be very effective.
Yes.
It's the South African one, which is still very low levels in the United States, where there's some questions. So Michael Osterholm, he's a very well-known epidemiologist who's been highly quoted during this pandemic. He said on Meet the Press, he's at the University of Minnesota, he said on Meet the Press last week that this B.1.1.7 variant and the fact that it's infecting children has caused him to rethink things a little bit. He's been one of the biggest proponents of reopening schools. He's made the point that kids don't get very sick and they're not really big spreaders of this virus, but this B.1.1.7 variant is starting to make him rethink this from what he's seen in Michigan.
Yes.
He was saying maybe we should put the pause button on reopening schools because of these outbreaks in the Michigan schools. Do you think we should put the pause button on right now?
I personally don't. I think we should absolutely keep a watchful eye, but I think we should move forward ahead with opening schools. The reason is, to quote Vinay Prasad, who was on your podcast, who's on a Healthy Skeptic MD previously.
He's a UCSF professor, oncologist, actually.
He made an analogy that stuck with me, and that is, if you get a hot plate of food, you want to eat it right away. You don't want to wait until it gets cold. And so I feel similarly to reopening schools right now, while the vaccinations are effective against the variants and COVID-19 or SARS-CoV-2. We should not wait until something worse potentially happens. We should seize the moment, in my opinion.
That's a little bit what we did in the fall. Here in LA, we did not open schools when case rates were low. And then just around the point where we started thinking about reopening, it was December, January, there was a big surge and it wasn't the right time. So what
Yes.
you're sort of saying is now case rates are low, let's jump on the opportunity to get kids back in the classrooms.
That's right. I think for a number of factors. One is that case rates are low. We now have a number of schools that have implemented safety precautions, and they've successfully kept schools open with those safety measures in place. And I'm very happy to see how many teachers and school staff have been vaccinated. It looks like over 80%, according to the CDC, of teachers, staff, and daycare providers have all been vaccinated with at least one vaccine. So
that's a really, really important point.
Yes.
80% right now of school staff have received at least one dose of the vaccine.
It's wonderful.
And that means probably in the next few weeks we'll be getting to the vast majority will be fully vaccinated.
And I think that's really incredible, especially when you think about safety concerns. If children really are spreading the B.1.1.7 variant more, we want to make sure that teachers are safe.
The obvious question about the B.1.1.7 variant, okay, kids get it, but historically kids have done very well with coronavirus during this pandemic. Could it be that kids will actually get more sick with the B.1.1.7 variants than the regular strain?
So far, from what I've been reading, it looks like the emphasis has been more on the fact that it's more transmissible or more contagious. I'm not reading quite yet, although it's possibly potential future news that it's more, causing kids to be hospitalized more frequently. But right now, it's looking like the concern is more that it's more contagious.
Yeah. So for me,
is that what you've read as well?
Yeah, but what I would say is for me that would be a game changer. If kids were getting more severely ill, obviously the vaccine is not. Kids are not eligible to get the vaccine yet.
Yes.
So if there's a strain out there that's spreading more readily in kids and they're getting seriously ill from it, that would be a game changer.
Absolutely.
For me. We haven't seen that happen yet.
Of course.
So
no, I mean, I say this all the time in my practice, but I think the best news of this entire pandemic has really been how children have been so minimally affected.
I think we saw there have been 317 kids in total in the United States who have died during the pandemic. Absolutely tragic. I don't want to in any way dismiss any child's life who's lost, but many of those kids did have pre-existing conditions. So I think overall it's about 1 in 10,000 death rate, and it's probably significantly lower than that when you consider all the undiagnosed infections out there.
Definitely. I know that there's been about 3 million known positives in children in the United States, and I'm sure that it's much greater than that because so many of the kids I personally saw in my office that were known positive, it was a surprise to so many families. They tested their children because, let's say, the parent was positive or a friend was positive. And so I've seen estimates that there might be even 5 to 10 times more positives than we even know about.
So back to the point that Michael Osterholm was making, whether we should be rethinking our approach right now. So I think it appears that kids do very, very well with this, including the B117 strain, although more to come on that. The vast majority of school staff have now been vaccinated, and we're starting to get the vaccine fairly widely distributed in the population. I think the most recent I saw is that by June, the Biden administration thinks that pretty much every adult in the United States who wants the vaccine will have been at least able to have gotten it.
And eligibility for all Americans, I believe by April 19th, they announced that by April 19th, everybody that wants to get the vaccine will be eligible.
So if you put that all together, you weigh the risks and benefits of reopening. To me, the worst thing that happens is we start having some clusters of schools where there's outbreaks, like in Michigan.
Yes.
And if that were to happen, the worst thing we could do is just take a step back, right, and close the schools.
Absolutely. I think we'll never know unless we try, even though I know it'd be a pain for a lot of parents in terms of coordinating childcare coverage and whatnot. But I absolutely think, given the success I've seen in many other school districts, I think it's worth a try. Absolutely.
And in terms of the question, what are the benefits of reopening schools? You deal with a lot of kids as a pediatrician in your practice. What are the health benefits to students and parents of getting back into the classroom?
So I think being social for kids is a great need. I think academics, it's really hard to replace school learning over Zoom. Especially we have younger kids. We have 3 kids of elementary school age. 5, 8, and 10.
And how's their behavior been during this pandemic?
You really want to talk about that? Not the best. They're good kids, though, but I give them a pass, of course, because what they've been going through.
But it hasn't been their best.
Yes. But I always think about Maslow's hierarchy. Do you know what Maslow's hierarchy is?
I forget.
Okay, so I'm going to paraphrase this, but it's the pyramid of human needs, and at the very bottom are the most, the bottom of the pyramid are the most basic needs, and you guys can look this up to double check me, but it's things like, fire and shelter and water, like our human most basic needs. And then you go a step up from that, and it's, safety. And then the step up after that is socialization and friendships and having relationships. And so where I'm going with this is it's a very basic human need to be social, to have relationships. And so I think beyond the academic part for children, I really think it's important for kids to have social interaction.
Yeah, so it just seems to me just intuitive that, there's a lot of upside, mental, emotional health. I see this in my adult patients who are at home working on Zoom. There's just higher rates of depression. We're seeing more substance use. And so I'm not an expert in kids, but I can imagine the same factors are occurring in kids who are not in that social environment.
And what's interesting, to be honest, is some teenagers, especially, I'm going to say teenagers in particular, they're liking this. They like, I know this is a little off topic, but they're liking being at home, sleeping in a little later, staying in their pajamas. They don't miss the social part of high school. And then I have many children that are really having a difficult time. They miss their friends. They want to leave their house. They miss, they feel really bad that they're missing out on so many events at school. So I think overall, I definitely think that kids should have the option to return to school as soon as possible.
And what about a parent who is not comfortable, or a child who isn't comfortable for whatever reason? Do you think it should be mandatory to get them back in the classroom?
I don't. I'm very sympathetic. It's been quite a year everybody's gone through, and I know every individual family has their own circumstances, health implications, social considerations to take into account. And so I know a lot of schools are offering both virtual learning and in-person learning, and I think that's probably the right move right now. What do you think?
Yeah, I'm a big believer in guiding patients, giving people options and, letting them decide what's ultimately right for them.
I agree 100%.
Especially it's a scary situation, the pandemic. Maybe
Yes.
next fall the expectation might make sense to the expectation to have everybody back in school, but I do like the idea of giving options to people
Right.
who aren't quite there yet.
Right, especially as we ease out of the pandemic, we see what happens with the variants, with the vaccination rollout. I agree 100%.
Okay, so one of the big concerns with kids is that the vaccine is not yet available for them. The Pfizer vaccine is, people need to be 16 or older to be eligible. Moderna, it's 18. Johnson
Yes.
& Johnson, I think, is either 16 or
18.
18 for Johnson & Johnson. But this week, there's actually some encouraging news. Pfizer submitted an authorization request to the FDA for the COVID vaccine. So that would be for the age group 12 to 15, I believe. So is that true? And on what data did they submit that request for the 12 to 15 age group?
So it is true. They're looking at emergency use authorization for kids as young as 12. The study, so my position on vaccinations for kids is I think it'll be nice to have at some point as long as we know that the vaccines are both efficacious so that they work well and that they're also safe. So, the vaccines are new. They haven't been around for years. And so when you look at, my feeling is you really have to think about the risk of the vaccine versus the potential risk of getting COVID. You weigh those two things out. And so with children, especially in that young of an age group, you're looking at a very low risk of COVID complications. Of course, you could think about potential spread to family and whatnot, but just looking at that age group by itself, there's a low risk of complications. So I like that we're looking into it and that we're studying it, but it's important to me that we really make sure that the vaccines are very safe in this group. So the study that was done in particular with this Pfizer trial, I believe the study only looked at 2,200 children. The good news is that the vaccine looked great. There were 18 kids that got COVID-19 in the placebo group, and then of the vaccinated group, there were 0 cases. So
100% efficacious.
100% right. So
albeit in a small population of 2,200.
That's right. So it looks really good. But when you compare that to the Pfizer vaccine had, I think, 44,000 in the trial. The Moderna vaccine had about 30,000 in the trial. So it'd be nice if we could get the number on par with those vaccination trial groups. I don't know that we ever will, just because it's harder to enroll children.
How about safety in that study of the 12 to 15 age group? Were there any major safety concerns?
No, not that I read.
Yeah.
But what's interesting is when you look at, as I mentioned before, if 8 out of 100,000 kids are hospitalized, just naturally, without forgetting about the vaccine in the in that age group, you're looking at a very low number affected anyway. So if 8 per 100,000 get hospitalized, and then the study only looked at 2,200.
It's going to be hard to prove
Right.
a significant reduction there.
Right.
You're going to need really big numbers.
Luckily, what I think is going to happen is vaccines are probably going to be very low risk for children, and getting COVID-19 is also very low risk for children. So,
but there might be some public health benefits of getting kids vaccinated.
That's right.
To the rest of us.
Yeah.
Do you think the FDA should authorize the vaccine for the 12 to 15 age group? I mean, it sounds good, but it's a small study.
That's a good question. I'm very sympathetic to both sides. On one hand, I see a lot of anxious families, a lot of anxious parents, children about COVID-19, and they feel such relief. I've seen a number of 16, 17-year-olds in my practice that have been vaccinated and they feel free. They've been vaccinated and all of a sudden now they feel a lot more comfortable living a little bit more of a normal life. And so that looks great. If it can improve quality of life, I support it. But then if families say, gosh, I'm hesitant, I don't know that I want to give it to my child right now because the vaccine hasn't been around long enough, we haven't seen great studies on it, I'm very sympathetic to that point as well. What do you think?
So, hearing you say that, what seems reasonable to me is to authorize it, make it available for kids, but perhaps it's not something you require or mandate yet in children.
I think if I were to be asked this question, I'm not a public health expert, but I would make it similar to the flu vaccine, where as long as it's been proven to be safe and effective, I would make it, an option for families.
Yeah. And maybe even encouraged, particularly as we get more data.
That's right.
Okay, so that's the 12 to 15 age group. This week, I think, or a couple weeks ago, I just heard the first kids younger than that were getting enrolled in studies. I think it was the 6-month to 12-year-old age group. So where are we with that?
So I've read that Moderna and Pfizer are enrolling children as young as 6 months into studies. I haven't read any outcomes yet, but I know that they are definitely actively looking into enrolling younger children. I heard from Dr. Paul Offit, who's been very involved in the vaccine studies. He predicts that by early next year, maybe January, will the vaccine be approved for kids that young.
Got it. Okay, so now I'm going to push you a little bit. We have 3 little kids.
Where are they? Who's with them?
The 10-year-old's watching the 7-year-old.
Okay.
So we have a 10-year-old, a 7-year-old, and a 5.5-year-old. 7-year-old's about to be 8. As he
maybe
will,
by the time this airs,
as he will be quick to point out. Tell us, first of all, a little bit about our history with them and the coronavirus. They got COVID.
So our whole family did get COVID end of December, and thankfully we all did well, recovered unscathed.
So I had a little bit of a fever, Jess a little bit more of the sniffles, and our older daughter had some mild symptoms, cold-like symptoms, a rash. The younger 2 didn't have any symptoms at all.
Yeah, so we were fortunate. But the question that I think what comes up on a personal level as these vaccine discussions come up, and as we discuss approving it for younger children, I guess this is a good place to ask you, but I wonder, will we want to do it for our children? I certainly get asked in my practice all the time when we talk about the vaccine coming out and possibly being approved for children. They say, "Doctor, would you do this for your own children?" And I answer with some hesitancy because our kids have had COVID recently, about 3 months ago. And so knowing that they do likely have some antibody protection, and knowing that the recurrence rate is pretty low, and given how well kids do, I'm not as in a great rush to give them the vaccine. I'm not opposed to it by any means, but I'm wondering what you think.
Yeah, if my kids had not gotten COVID, our kids, and the vaccine had been authorized by the FDA, and there was at least several thousand that it had been studied in kids, I think I'd feel comfortable giving it to them. And I think my main motivation there would be the public health benefit, because the more kids you get vaccinated, the better it's going to be to the community.
Right.
But I agree with you. I think given that they have already had COVID, they probably have pretty good immunity to it. I'm not in any rush to do it. That's my honest opinion.
Yes, especially until the vaccine's been well studied and knowing that they're low risk of getting it and spreading it.
And I'll even say, I myself just had COVID about under 4 months ago. I am absolutely no safety concerns myself with getting the vaccine. I'm not looking forward to the shoulder pain and the fever that may happen. But I'm definitely planning to get it myself. I wanted to give it a few months to kind of wash out from that previous infection. But I certainly have not been in a rush myself to get it because I recently had COVID.
And I did get the vaccine as well.
She's tougher than me, so she got it even though she recently had COVID.
I'm not going to argue on that one. I'm just kidding. So I think, I wonder too, in the past when we've had illnesses where kids have actually recovered. So for example, I think about the chickenpox, when we can document that kids have had the chickenpox and they still have immunity in their blood, they do get exempt from getting the chickenpox, which is a required vaccine for school entry. They are exempt from that vaccination if they can prove, previous documented illness. So I wonder, what do you think about that in terms of COVID? Do you think that potentially kids should be exempt from the vaccine if they've had the illness and they can document antibodies?
This is something that my adult patients ask me all the time too, is, I already had COVID. Do I still need the vaccine, and should I get the antibodies checked? I think in theory it makes a lot of sense. The problem is in reality, the antibodies only last for a few months. But that doesn't mean the immunity's gone, because immunity is not just the antibodies, it's also the T cell response and other factors. So just because somebody doesn't have antibodies doesn't mean that they don't still have pretty good immunity.
Right.
So the short answer is I don't really know. I think that's a reasonable thing to consider. And if they have antibodies that provide some reassurance, that maybe getting the vaccine is a little bit less urgent. But, there's just a lot of uncertainty right now about that.
Yes. I don't know if I told you this, but I did get my antibodies checked last week.
And you are positive.
And I'm positive, yes.
Yeah.
So that did feel, I don't know how much of a difference it makes, but I did feel, it was nice to see that.
Yeah. And just to touch on overall safety issues with the vaccine in general, not just in kids, it's now the vaccine's been given to more than 180 million Americans, many more worldwide. There's been pretty good assessment of the side effects.
Yes.
What do we know so far about the overall safety of the vaccine in adults?
Yes. So as cautious as I'm sounding about children and vaccines, I just want to say that overall, I am so impressed with the vaccines that have come out. When you think about the fact that we didn't even know the blueprint for the virus, the DNA blueprint, until last January, and the fact that in just over a year we have over 183 million Americans vaccinated, it's amazing, really, and that how well it's working. So usually with the flu shot, we're thrilled if the flu shot's like 50% efficacious. And these vaccines are working so well. And then the other piece of it is they're looking really, really safe. So most vaccines that have come out, we know about serious side effects within like 6 to 8 weeks of the vaccines being released. And so now we have over 6 months of data on these shots with lots of vaccines given in real time, and they're looking really safe. I think the things to keep in mind, people ask a lot about anaphylaxis, which is looking really rare.
Anaphylaxis is severe systemic immune response.
Yes.
Allergic reaction.
An allergic reaction. It looks like about 4 per 1 million have this anaphylaxis reaction, which is on par with other vaccines we've given in the past.
And what's the time, when do you get an anaphylaxis reaction after getting a vaccine?
Usually within 15 minutes. So, you're recommended to stay at wherever health facility you get the vaccine for about 30 minutes and just make sure they have epinephrine.
The only caveat I'd say to that is, about 90% are within the first hour. So what I've been telling my patients who have a history of anaphylaxis, those are at really high risk, maybe wait around more in the 45-minute to an hour range.
Sure. But it's easily remedied, or not easily. No one wants to get epinephrine, but it's treatable with epinephrine. So as long as you're somewhere where they have EpiPens or epinephrine, you're in good shape. I saw a lot of viral videos going around by people that fainted after getting shots in the early days. And that's something that's really normal with shots. It's called a vasovagal response. Some people are very sensitive to looking at needles, and they get, queasy feeling, and they can even faint. And that's not anaphylaxis. That's not an allergy. They recover perfectly, right?
Yeah, and I think it's fair to say that's not true of just the COVID vaccine. The flu vaccine, the pneumonia vaccine, all sorts of vaccines will trigger those vasovagal reactions.
Yes, and a couple other points about the safety of the vaccines. These vaccines were not made with food or environmental products, so a lot of people will wonder, I'm allergic to peanuts or different foods, or I'm allergic to pollen, things in the environment. And you don't have to worry with the vaccines. They are safe. You're still recommended to get them even with allergies. The only allergy that I know that's in question with the mRNA vaccines is the polyethylene glycol, or we call it PEG. And it's one of the main ingredients in a laxative called Miralax. It's also found in some cosmetic products. But that's really it. And I think people that have allergies to polyethylene glycol, they're aware of it. So anyways, it's looking really safe, low incidence of anaphylaxis. And then weird questions come up in my office. People are asking me about possible, there's some myths going around that I want to dispel. People are asking me about, effects while you're pregnant, and will it affect my teenager's fertility? And that is 100% myth. I've never read that based in science at all. Have you? I keep getting that question.
Not that I've heard.
Okay. So
in any reliable journal.
Not in any reliable journal. So hopefully, that's been some of the hesitant.
What about the mRNA? Can it get into your DNA?
That's a really good question. So we call this the central dogma of biology. Like the biology principle is that we go from DNA, then to RNA, and then we make protein, and does not go backwards. So because DNA is where our genetic blueprint is, with the mRNA vaccines, we're starting with RNA moving directly onto protein. So because we're starting at the blueprint of RNA, we're not going backwards. So no, that
it's not going to get into our genome.
No. I hope that wasn't too too much biology.
Yeah, that's a question that patients have raised.
That's right. Yeah, it cannot go back into our cells, into our DNA.
Okay, so this is a really good discussion. I'm just going to try to summarize the key points.
Yes.
Things are going well with the pandemic. Rates are a lot lower than they were several months ago. We're not entirely out of the woods. The variants that in particular we're concerned about now are the B.1.1.7. There's been clusters of infections among children in particular. So that's an area of concern. But so far, the good news is kids don't seem to be getting particularly sick from that or any other variants. Kids do well overall.
I do believe that if we can really emphasize vaccinating those, 20 and older, and really get the vaccination to be amongst most eligible Americans, I really think we're going to see the pandemic dwindle. Do you?
I'm optimistic.
Yes.
The variants are certainly a curveball, but if I were a betting man, I would think by this summer we're in really good shape.
Good news.
And so my very last question for you is: our kids' schools are reopening not this week, but next week. Are we ready to send our kids back to school?
Who's going to do the drop off and the pickup? Yeah, I'm very ready. I'm excited about it. I know our kids are really excited about it. They've been so gleeful, that they're going to see their teachers in person, see their friends in person. I'm very excited for them and for the rest of children.
Yeah, and I think, as you said before, now's the time before the food gets cold.
That's right.
Things are looking really good in LA and many parts of the country. So let's be ready for anything, but hope for the best.
Cautiously optimistic, healthy skeptics.
And again, make sure to check out Ask Dr. Jessica YouTube channel to get your pediatric questions answered. Well, thank you again for joining me, Jessica Hochman, my wife.
I'll come back anytime.
And if you enjoyed what you heard today, you found it was interesting, engaging, subscribe to the Healthy Skeptic MD wherever you listen. Leave me a review if you have a chance and share it with others who might be interested. We'll pick it up again in 2 weeks. Thank you.